Living with diabetes is more than just managing blood sugar levels. It can take a serious toll on mental health. For many, the diagnosis alone brings a wave of emotions, but over time, the condition's impact can be far deeper. Today, we'll explore how diabetes can silently erode your mental well-being and what steps you can take to protect it. Let's start with one of the most common challenges: stress and anxiety. Managing diabetes isn't a part-time job. It's a 24/7 days responsibility. You're constantly monitoring your blood sugar levels, thinking about your next meal, managing medications, and dealing with the unpredictability of how your body might react on any given day. All of this adds up to a lot of stress. And over time, this constant vigilance can start to weigh heavily on your mental health. Imagine waking up every day and the first thought on your mind is, "What's my blood sugar?" Or, "Am I going to be okay today?" That kind of pressure can make you feel on edge, like you're walking a tightrope with no room for error. It's easy to see how this could lead to chronic stress and eventually, anxiety. You start worrying not just about the present, but also about the future. Will my condition get worse? Am I doing enough to stay healthy? These questions can play on a loop in your mind, leaving you feeling mentally exhausted. But that's just one part of the story. There's also something called diabetes burnout that many people face. When you're constantly dealing with this condition day in and day out, it's normal to feel emotionally drained. You might start to feel like no matter what you do, it's never enough. The effort of keeping up with all the management tasks, checking your blood sugar, watching what you eat, staying on top of medications, can feel overwhelming. And sometimes, you just want to throw in the towel, even if it's just for a little while. In these moments, it's easy to feel frustrated. You might think, why do I have to deal with this? Why can't I just have a normal day without worrying about my health? This sense of frustration and fatigue is what leads to burnout, a point where you might start neglecting your diabetes care because you're so emotionally worn out. The tricky thing about burnout is that it can create a dangerous cycle. The less you manage your diabetes, the worse your physical symptoms might get, and that can lead to even more stress and feelings of hopelessness. Speaking of emotional strain, let's not forget about depression. Studies show that people with diabetes are actually twice as likely to develop depression compared to those without the condition. Think about it. Living with a chronic illness means you're constantly aware of your body and its limitations. It's like carrying around a weight that you can't put down. And sometimes, that weight becomes too heavy, making it hard to enjoy life or feel motivated to do things you once loved. Depression can sneak up on you, too. Maybe you start feeling tired all the time, not just physically, but emotionally. You don't have the energy to take care of yourself the way you used to. Simple tasks like getting out of bed in the morning or preparing a healthy meal can feel monumental. And the worst part is, when you're feeling down, it becomes even harder to stay on top of your diabetes management, which can then make you feel worse. It's a vicious cycle that's tough to break. Another aspect that might surprise some people is the link between diabetes and cognitive decline. It's a lesser-known consequence, but it's an important one to talk about. Studies have shown that people with diabetes are at a higher risk for things like dementia and memory problems. Why is that? Well, it turns out that high blood sugar levels can damage blood vessels, including the ones in your brain. Over time, this can lead to cognitive issues, trouble concentrating, difficulty remembering things, and even problems with decision-making. This is especially challenging because when you're dealing with diabetes, staying sharp and focused is crucial. You need to be able to make quick decisions about your health, like adjusting your medication or choosing the right foods. But if your brain is foggy or you're having trouble concentrating, it becomes harder to manage your condition effectively. It's almost like your body is working against you from both sides. Let's talk about something that doesn't get enough attention: social isolation. When you're living with diabetes, it's easy to feel like you're different from everyone else. Maybe you can't eat the same foods your friends are eating, or you have to step away from a social gathering to check your blood sugar. These small but constant reminders that your life isn't quite like everyone else's can start to take a toll on your self-esteem. You might find yourself avoiding social situations because you don't want to feel like the odd one out. Over time, this can lead to feelings of loneliness and isolation, which are harmful to your mental health. It's important to understand that feeling isolated can happen even if you have people around you who care. Sometimes, the emotional burden of managing diabetes can feel like something no one else understands. You might feel like you have to handle everything on your own, which can make the loneliness even more intense. However, there is hope. While diabetes can significantly affect mental health, understanding these challenges is the first step toward overcoming them. Building a strong support system, whether through family, friends, or support groups, is crucial. Additionally, seeking professional help from a therapist or counselor can make a world of difference in managing the mental load of diabetes. In conclusion, diabetes affects much more than the body. It can deeply impact mental health. The constant management, anxiety, risk of depression, cognitive decline, and potential social isolation all contribute to the emotional strain. But with the right strategies and support, it is possible to navigate these challenges and maintain both physical and mental health. If you found this video helpful, don't forget to give it a like and subscribe to our channel for more content on health and wellness. Stay tuned for more insightful discussions that can help you live a healthier, happier life.